Let's get you the latest as far as the national capital is concerned. 325 cases of COVID-19 have been reported in the last 24 hours, the highest in the last 40 days. Now, 325 cases in 24 hours is the highest since the 3rd of March. The DDMA, that's the Delhi Disaster Management Authority, are planning a meeting on the 20th of this month to take stock of the rising cases as far as the positivity rate of Delhi is concerned. Cases are also rising in schools across the Delhi NCR region, with the government now asking all private schools to notify the government about cases and close down the affected wing or, in fact, the entire school if the need be.
कोविड के केस लगातार बढ़े हैं और
उस पे हम नजर रखे हुए, हॉस्पिटलाइजेशंस नहीं बढ़ रहे और अभी चिंता करने की किसी जरूरत नहीं।
मैं लगातार नजर रखे हुए हूँ, किसी भी स्कूल में कहीं एक भी केस आता है किसी टीचर या किसी एक बच्चे को, तो उस वक्त स्कूल भी हमको रिपोर्ट कर रहा है और हम भी स्कूल को जो भी दिशा निर्देश हैं इंडिविजुअली दे रहे हैं।
Well, we have with us Dr. Suranjit Chatterjee, Senior Consultant Internal Medicine, Indraprastha Apollo Hospital, joining us this morning to get us more on this rise as far as cases are concerned. Dr. Chatterjee, we're seeing a rise in cases all over again as far as the national capital is concerned. Like I mentioned, the cases as far as the weekly positivity is concerned, also the daily cases that are coming up now more than what we've seen in the last 40 days. How concerned should we be?
There's nothing to panic, as everybody is saying. But yes, we need to be definitely cautious and we need to really follow all the COVID appropriate behavior, because actually these numbers may be low because quite a few people nowadays also do home testing and people don't report it to the government authorities. So, and even if in my private practice, what I'm seeing is the number of calls which I get from different patients has definitely increased in the last 7 days. So I would say that there's nothing to panic right now. We have to live with it in all probability. But if we don't take all the precautions, then we might be in trouble.
Right. Is it time to bring back all some of the COVID protocols, such as the mask mandates, as well as those fines for not wearing masks?
I think so, because people have become too callous and the gatherings and all that have increased really significantly. And we were always saying, at least I was always saying, that for the next couple of weeks, we should be careful because we have always followed the West. And we could have done it slightly slower. I would definitely agree that they needed to be relaxed. But obviously, mask wearing has to be made compulsory again, I suppose.
Right. Doctor, you mentioned the West. We are seeing a rise in cases as far as New York and Washington are concerned. Also parts of Europe we've seen as far as France and Germany is concerned. More than 1 lakh cases a day. Even in South Korea, the cases are above 1 lakh. We're seeing this upward trend in Delhi. As far as Delhi is concerned. So is this a pattern that we are seeing, that the cases are starting to rise all over again? What kind of precautions should we be taking at this point in time? As far as 325 cases that we've seen, 137% rise in cases as far as the last 1 week is concerned in the national capital. We're seeing schools are also being shut down because of this, because of the teachers testing positive, the students testing positive. Do you think it is important to take that call, especially for the age group of children who are not even vaccinated yet?
Yes. See, I'm really not bothered about the children. I'm not worried about them that much. They all have a bit of an inflammatory syndrome. They can have, but they have been doing otherwise well. They have fared well even if they have had the infection. But what is more worrying is that they might carry the infection home, where they could be having vulnerable people like their parents or like their grandparents. And if they get infected, then we might be in trouble because the vulnerable group might behave in a different way. Although till now, whatever cases we have had, they are very mild cases. People have not really required hospitalizations. One or two of my patients required hospitalization, but that was for a different reason. But we have to start taking precautions all from now.
Right. We also have Dr. Ishwar Gilada, consultant in HIV and infectious diseases and Secretary General, Organized Medicine Academic Guild, joining us this morning. A very good morning to you, Doctor. If you could just take us through the precautions that we should start implementing at this point in time. As far as the cases are rising, we do know that the XE variant is in fact more transmissible than Omicron. If you could take us through the variant that is dominant among the recent cases that we've just seen.
See, Divya, XE variant is more infectious, but is only 10% more infectious. Somewhere it is mentioned 10 times more, that is wrong. Secondly, India had very gladly digested almost 3 lakh cases per day, almost 6 weeks back or 2 months back. So I think we should not be panicked only because of numbers rising. We need to look at trajectory of them. How many of them are landing up in hospital, requiring oxygen, ICU bed, or ventilator, or death. Currently, if you look at the case fatality rate, for India it was cumulatively 1.3%. It has come down to 0.2%, 0.1%. So I think that is what we wanted, that when the flu or the normal seasonal flu has a case fatality rate or infection mortality rate of 0.1%, if COVID brings down there, I think that is the best thing to happen. So just by some mere numbers or what is happening in the east or west, we should not be bothered at all. We should not be perturbed at all. Secondly, we should expect that some cases will come in school or opening up, people are going on travel, tourism, socialization. We should not give any heed to that. And lastly, we should also have some way to challenge. Otherwise, for example, if you develop some allergy and you start anti-allergic drug, how do you know that anti-allergic drug has to be stopped? So you need to stop 1 day, 2 days and check again. So similarly, whatever precautions we were taking earlier, fine. Whatever opening on is fine. But if there are some cases happening up, suddenly have another COVID appropriate behavior, a lockdown or mask or something, I think that is not required. Mask is not mandated, but if those who are concerned, they can wear mask. Nobody is going to stop them from using mask. Our vaccination should go on, our booster dose should go on. If you look at the fatality rate or morbidity, etc., they are inversely proportional to vaccination. So in that sense, vaccination will definitely help, and it has helped all over the world. Wherever there is a vaccination is poor, people are dying. So if you look at East, Korea or China, etc., they had suppressed their first and second wave with severe lockdown. So third wave or fourth wave they are caught. We had first and second wave very severe, third wave was mild, and now nothing was going to happen in the fourth wave. So somewhere all human beings all over the world are going to be infected with Omicron or any COVID virus. So if you suppress them in first or second wave, third wave you will be caught.
Dr. Gilada, you mentioned about vaccination. So that age group of students who are not been vaccinated, how safe is it for them to be going to school? And if you could help the parents make up their mind whether they should be sending their kids to school or not.
See, safety of the student depends on safety of teachers and parents. If teachers and parents are vaccinated, staff is vaccinated, and children are not vaccinated, it is not going to make much difference. Even if children get infection, they are milder. And with Omicron, we have learned one thing, that Omicron has turned out to be a variant of support to India. It has not been variant of concern or variant of interest of investigation. So in that sense, we should not be bothered at all. We already closed down the school for 2 years. We do not know whether it was right or wrong strategy. But once we have opened up, we should be with it. Okay, you can have some kind of distancing. You can have staggered timing. You can divide batches into 2. You can have 3 days a week for one batch, 3 days a week, another batch. We can do all that. But we should never talk about any kind of clamp up activity now.
Right. Right. Dr. Chatterjee, Dr. Gilada saying that wearing a mask is not necessary, but don't you think it's time, like you mentioned, that those mask mandates should be back because they have protected us in the past? Of course, we are seeing a rise in cases as far as Delhi and the NCR region is concerned. Some schools have shut down, also in Noida, in Ghaziabad as well. We're seeing cases rising in Gurugram per se. In the last 1 week, the cases are up by 100%. So, what kind of measures can we take? If you could help the parents, in fact, decide, because, they are all the ones who are deciding if their kids should be going to school or not. So, is it a good idea for the students to be back in school, or should they go to online classes again?
No, I would still think that the schools and all that should not shut down right now. But yes, the precautions have to be followed, because I would slightly differ that we cannot go and reach a peak and then start taking all the precautions. I would rather err on the precaution side rather than rising to a level where things become uncontrolled. Because we have seen what things happen. I'm sure that will not happen, because we are all vaccinated. We have a lot of Indians have a hybrid immunity. They have been infected. So the chances of it really reaching that Delta type of wave is very, very unlikely. But I would rather err on the precautionary side, because precautions are nothing much. You are used to wearing a mask. Where is the harm in wearing a mask? There's no harm in wearing a mask. I'm not asking to shut down schools at all. The school should continue. The children should go. But yes, We have to protect ourselves. They should be wearing a mask in the school. They should be following all the COVID appropriate behavior so that the cases don't go up. And the elderly people who are vaccinated, I know that they are much safe than what they were a year back. But if we don't have the COVID appropriate behavior, the numbers might go out of hand. As of now, we are comfortable. There's nothing to panic, but there is no harm in following the precautionary measures.
Right. We also have Aditi Mishra, the director and principal of DPS Gurugram, joining us. Mrs. Mishra, if you could just take us through the kind of precautions you're taking in school at the moment. What are the protocols that are being followed to ensure, especially since you've known that the cases are on a rise, anything special that you've added? What are the security, the measures that you're putting into place?
Divya, I can't hear you very well. I'm not sure if you can hear me.
Yeah, you please go ahead.
I couldn't hear your question, but I presume it's about the corona cases, and I presume it's your view on what we should do as schools.
Right.
So what is happening right now is children have come back to school barely 4 weeks ago, and they're about almost 75 to 80% students in school now, happy to be back in school. And every day there are about maybe 1 or 2 cases in 100 that come up with fever and cough and cold. And most parents say it's just a cough and cold, and most of the children are not checking or not testing positive for corona, although we are treating it like corona. So in all such cases, we inform that particular class immediately so that parents are aware and there's nothing to hide, there's nothing to stigmatize. And we ask the parents to just keep a lookout for any symptoms in their child. That class is then sanitized thoroughly morning and evening, and we ensure that all the children all the time are wearing masks and staying safe and far away from each other. I think there is very little else a school can do. We do make an effort to make the children go out in small portions. That's also becoming a little difficult because it's very hot outside after 11 o'clock in the morning. But children have been made aware, so the masks are on, the distancing is on, the sanitization is on. As of now, I don't see any reason to panic. Yes, we have to be cautious, but I don't think there is need to panic and start shutting down school, because that will be actually catastrophic right now.
Right. The Delhi government has said that they'll shut down a wing of the school or the entire school if the need be, if students test positive. So, and we do know that some schools have already shut down on account of COVID cases. So, would you also be retorting to such measures if the cases rise?
Was that for me?
Yes, ma'am.
Couldn't hear you. Sorry. There's something terribly wrong with the audio.
Right. So I'll take this question.
Can you say it again? I can hear you now.
Yes, ma'am. So some of the schools have, been shutting down because of COVID cases, whether it's in Ghaziabad, also in Noida. The Delhi government is saying that, you can shut down a wing or maybe the entire school if the cases rise. You in Gurugram, would you also be looking into shutting down schools or a wing or a classroom if the cases are on a rise?
So like I said, the idea is not to shut down schools. That's not going to help. It's not as if the children are getting infections only from school. They are going out. They're going out to play. They're meeting friends. They're going to restaurants. They're going to the malls. They're going for cinema. So the infection can be caught anywhere. I think individual caution is required at every step for everybody. The masks have come down. I can see that. While in school, we insist that masks are on. Every class has a mask monitor who make sure that masks are on top of the nose and not dangling below. There are a handful of children who have asthma who can't wear a mask. They have been asked to sit near the window so that they don't feel too suffocated with the mask and inside a closed room. Right. We are trying to take every precaution. So if the question of shutting school comes, I think it's a big no from most educators and parents.
Right, absolutely. So measures being put into place as far as schools are concerned. The Delhi government leaving it to the schools to decide whether they need to shut down if COVID cases are increasing in the schools or not. For now, the hospitalization cases are low. So for now, we're safe, but the cases are rising. So please do keep that mask on because that is very, very important. Thank you so much for joining us this morning.